MENA is the beginning of our women's health journey, whether we are a girl of 8 or 15. As a medical or allied health professional, you will know that biomedically a child reaching menarche after the age of 8 is considered normal if biological markers are or have been met. What is missing is the recognition of the mental health impacts. Here are some relevant findings from international research. The age of menarche has fallen 3 to 5 years in the last century. There are more potential negative consequences for girls reaching menarche aged 8 to 12 than those 12 or above. Menarche before the age of 11 increases experiences of depression, and these mental health events can last 4 to 6 years longer than girls who experience menarche age 12 and above. 1/2 of all mental health problems emerge by age 14. Early puberty is more likely to lead to poor academic performance, and peer relative experience is a crucial factor in all mental health outcomes. Environmental circumstances also have an important impact. When we are 8 or 9 years old, the last thing we want to know is our body is ready to bear children, and it is tricky for parents and carers who are unprepared for the reality of supporting an 8-year-old through puberty. If puberty and menarche occur between the ages of 8 to 12, there is significant potential for development to slow. Girls revert to ensuring physiological needs and personal safety are met. Early intervention with clear children's health literacy is key and should be implemented in line with a girl's cognitive and emotional capacity. And what is that? Let's think about it. These girls are in primary school, so they're learning to read and write, further developing their gross and fine motor skills. They're learning their times tables. They're exploring their talents. They're establishing friendships. EPG Australia's mandate is to work within what already exists. The aim is to add value to what you are already doing by demonstrating improved ways to be inclusive. As medical and allied health professionals, we need to be aware of where we can direct our young clients and their families for support to bridge the gap that develops between their experience of periods, hormonal changes and brain development with their need to remain a child. So what can you do? If a child presents with puberty issues, it is important to ask them if they've experienced menarche or feel they may soon. I suggest not speaking about fertility and sex during this brief interaction. You could tell them some interesting facts about body cycles and how they fit together to make us who we are. You can refer the family to our website where they can find lots of information and get in touch with us. Or you may already know of some existing services in your local area. I am developing resources, a bank of online tools and visual aids, and creating networks of on-the-ground services for this very purpose. I connect with families, schools and health networks as I recognise the importance of a preventive, collaborative care approach when empowering girls to self-manage their needs. As a medical or allied health professional, you can be a part of this movement too. Join me at epguidanceaustralia.com to receive updates about the latest research, online tools and courses, or to get in touch directly.